Hey, good morning, everybody. This is Matt Phelan, Public Policy Manager for Alzheimer's Association Michigan Chapter, and I'm joined today with.
Greg Bird, Director of Public Policy for the Alzheimer's Association of Michigan. Good morning.
We just want to take this opportunity. It's hard to believe, but it's been about a month since we were in Lansing down at the Capitol for our State Advocacy Day, and we just wanted to take a minute to give a couple updates on some of the asks we had there. I'm going to pass this over to Greg in a minute, but we've had some action in the Senate on the budget, and we're still waiting in the House. So, Greg, if you could update us on those things, on the and for the just a reminder, we're asking for a $2 million increase in funding for the Dementia and Healthy Brain Unit at the Michigan Department of Health and Human Services. So, Greg.
Matt, appreciate it. And as always, I appreciate all of your efforts, whether it be Advocacy Day or other times that you've reached out to your local lawmakers on issues that are important to all of us. Um, Matt, put it accurately, as we all remember, we are requesting an additional $2 million for the Dementia and Healthy Brain Unit. Um, and the Senate has passed their budgets. Unfortunately, they did not include the $2 million increase. So now we are laser focused on the House. They have yet to pass any of their budgets, so we have still some time to reach out to House members, whether they be on the subcommittee, the full Appropriations Committee, or if they're just on other committees. So if you haven't had a chance to do so, please reach out to your state representative regarding the additional funding for the Dementia and Healthy Brain Unit. That would be a tremendous help. As a result of Advocacy Day and your efforts, we already have had a number of people on both sides of the aisle that have sent letters of support for that additional funding to their legislators. So your input does matter, and if you need, I think Matt has already sent copies of that letter that you could use. If not, we're happy to send that for you. So we still have time. So hopefully we can get that across the finish line.
Yeah, so thank you to everybody that has followed up with their lawmakers since Advocacy Day, because as Greg mentioned, we've had a lot of state reps and even some senators send that letter of support for the $2 million increase to Representative Phil Green, who is the chair of the health budget that we're focused on in the House. So if you haven't done so, please do. Even if your legislator said they were going to send it, it's great to follow up with them to make sure they did. And get that confirmation. I know just in my last email a couple of weeks ago, people wrote me back and said that their legislator did confirm that. So that's great to hear. And there's still time to do more. The other update we want to give is on our first responders bills and kind of what's going on there since Advocacy Day. So we do have some updates on that in the bills. So I'll let Greg fill you in on all that.
Yes. Again, as a result of your advocacy, whether it was our advocacy day or otherwise, we now have more sponsors, more people willing to co-sponsor. Again, both sides of the aisle. So we're really excited about that. We now have drafts. Three separate bills, one for the training for police, one training for fire, and the last bill would be training for EMS. So we plan on three separate bills in the House and the same three in the Senate. So we just are in the process of finalizing the six sponsors, and we hope to get bipartisan support for those. So that's where we are in the process. We're really excited. I know it's been a long time coming, but we are getting closer to introduction. And obviously, once those bills are introduced, we will let everybody know so we can again reach out to our elected officials regarding those.
Yeah, Greg. And as you mentioned, this has been a while coming, but there was some strategy that we had to take into consideration, whether it be one bill, whether it be three bills, how we move forward, working with the potential sponsors we have in the House and the Senate and what they wanted to do and what they were comfortable with. And so I think we're in the end stages there. We're looking for some Republican support on those bills. So if you know of any Republicans that were very positive about this, reaching back out to them would be great. And we really are looking to introduce those very soon, but we just want to make sure we have the right sponsors on those bills as we move forward, because that matters when you get to Lansing, of who sponsors your bills and whether you have a chance of moving up. But yeah, so now we have three bills, one for each, with each arm of the first responders, and we're looking forward to kind of moving that forward. So that's most of our update for right now of what's going on. The legislature is still in session and will be right up to probably the 4th of July this year, working on the budget, working on different bills and things like that. And we actually expect this to be a busier summer too with the legislature. Things might roll over in the summer. We might be reaching out to do more in-person things in the summer when they're more accessible back in their districts. So please stay tuned for that. But in the meantime, please follow up with them and contact them again today or next week or this week, and let them know that we're still working on these issues and there's still things that they can do to help us. So I want to thank you for everything you've done. And if you have any questions anytime, feel free to reach out to us and we can provide you answers and any resources you might need, electronic copies of that sample letter to the um, health budget chair and things like that. So thanks again, everyone, and have a great week.
Thank you.